Mastitis and plugged ducts. We're going to dive into both and give you facts and tips and really help you through in case you get the dreaded M word, mastitis. So mastitis is a breast infection. So what happens is if milk gets trapped in the breast, and that's whether you have a plugged duct or you just sleep through the night and you don't empty the breast, stagnant milk breeds bacteria and develops a staph infection, it's Staphylococcus aureus, in the breast tissue. So your breast will get red, have some red streaks on it, and as it progresses, it gets worse and worse and worse. So the goal is to catch it as soon as you can, because there's really two different options. Either we get the milk out, that allows the body to fight the infection on its own, because that's the source of the infection, or you take antibiotics. With taking antibiotics, the hard part is, again, it's a Staphylococcus aureus, and there's a lot of antibiotics that don't work with that type of staph. So I've had patients come and say, I've had mastitis 5 times, when in reality, they were given the wrong antibiotic and the wrong advice, and they didn't have it 5 times. They've had it once. It just keeps coming back. So mastitis in general is stagnant milk. So what's the best way to fix that problem is to get the milk out. So with a breast infection, the first recommendation that we have is to get that milk out. I have had debates with other lactation consultants about, well, if you get the milk out, then you're going to tell the body to make more milk. In this case, it's an intervention. You have a breast infection, you have to get the milk out in order for your body to fight the infection off. So, first symptoms, flu-like symptoms, red streaks on the breast, hard areas on the breast. It's go time. We need to get that milk out. So, trusted electric pump. A baby never fully empties the breast, but the pump is a machine. The pump will pump until the breast is empty. So, it's sometimes better to use the pump than the baby because we want to fully drain that breast and get all the milk out. And once you do that within 24 hours, the infection should be cleared. So, pumping, excellent. What about if you don't have success with the pump? The infection has progressed to the point where you're in so much pain that it hurts to pump. You might freeze up and not have a letdown with the pump because oxytocin is controlled by the brain. So, first step, pump, get the milk out. Do breast compressions if you have hard spots. Really grab and squeeze that area and fully drain that breast. Fully, till it's nice and soft. It will still be red. It'll still feel like the tissue is infected, and it is, but we're removing the source of the infection, which is the stagnant milk. A plugged duct is a piece of fat that's gotten caught in all the ducts. It's kind of like a bushel of grapes. Your breast is filled with all these alveoli and there's no rhyme or reason to it. The ducts can intercross, and then you have between 9 to 19 openings on the tip of the nipple. 9 times out of 10, if you do have a plugged duct, it's on the nipple. So, best advice I can give you is take a warm shower. Let's take a look at your nipple and see if you do actually have a plug. So the difference between pumping, suction, breastfeeding, compression, manual expression, totally different. That's you in the shower trying to get milk out. So it's kind of rolling more than pulling. So I'm going to use my little unicorn to give you an example of manual expression. if you do have a plug duct on your nipple, it will look like a zit, like a whitehead when you manually express, and you'll be able to see it and possibly remove it from your nipple. So manual expression, it's kind of an art form. When you first start doing it, milk will trickle out, and the better you get at it, you can like shoot milk at other people if you wanted to. You could shoot it across the room. So these two fingers, you're basically going to push back on the areola and roll your fingers forward. Back, roll, back, roll. That will cause a milk ejection reflex. If you're having problems getting a milk ejection reflex with the pump, this is something you can do right before you pump. Like right before, not 15 minutes before, right before, is some manual expression. So 2 fingers, this is the areola, you push back, this is the nipple, roll your fingers forward, back, roll your fingers forward. If you see something on the nipple, again, you have between 9 to 19 openings that looks blocked, the best recommendation is to take a warm shower, do some manual expression, and gently exfoliate your nipples with a wet washcloth. If you can get a hold of a sea sponge, a natural sea sponge, those are actually living and they're antibacterial and antifungal. So if you want to be proactive and make sure you don't get any plug ducts in the nipple, I would purchase a sea sponge, and every time you take a shower, that's what you wash your nipples with. They tell us kind of don't touch them, they take care of themselves, but skin can grow over and block those openings, and then you have some problems. This is a therapeutic ultrasound machine. It's found in every physical therapy office, and what it does is it reduces inflammation. So if you have a very bad infection and no matter what you do, you can't get the milk out, you can seek out a physical therapist's office and see if they have a therapeutic ultrasound machine. What this does is hot and cold at the same time. So it reduces inflammation and also warms the breast and allows for the milk to come out even if the ducts are all inflamed. So if you do therapeutic ultrasound treatment, the goal would be to pump immediately after the ultrasound treatment. What they'll do is they'll put some gel all over your breast. It's about 15 to 30 minutes of the therapeutic ultrasound. They do that, it reduces the inflammation, but if you don't pump right after, you're not going to have success with it. So it's getting the milk out. The therapeutic ultrasound is a way to reduce the inflammation and allow the milk to flow a little bit better. So same tips with the coconut oil. You can lubricate your areolas when you're doing manual expression or pumping. But again, the bacteria statistically found in most cases of mastitis, and we have tested the milk of thousands of women, is Staphylococcus aureus. So the most effective antibiotic as of today is cephalexin or Bactrim or Septra. So there's 2 basic antibiotics that are the most successful. Amoxicillin does not fall into that category. And if, for example, you're prescribed it and your symptoms get better and then the mastitis comes back, that antibiotic did not kill off the infection. So if you have mastitis and it's getting worse and you can't get the milk out, no matter what you do, you call your OBGYN, explain that you have mastitis, and you can ask and just suggest, can I please have Keflex or cephalexin because it kills Staphylococcus aureus? Or if you're not allergic to sulfur-based antibiotics, ask for Bactrim or Septra and speak to your OBGYN.